Welcome back to Healthy Living for Life. Our next guest is from Missoula's Community Medical Center, Dr. Charlotte Kutsch. Dr. Kutsch is a board-certified dermatologist at the Family Dermatology Clinic. She practices medical and surgical dermatology and enjoys seeing patients of all ages. Dr. Kutsch, thanks and welcome to the show.
Thank you.
Let's start off by having you tell us what really spurred your interest in dermatology.
You know, I became interested in dermatology while I was still a medical student. And as a medical student, I was able to actually get involved in some research, and I did some research on the microscopic anatomy of the skin. And I just thought it was so interesting how what I saw in the dermatology clinic was really backed up by science of what was happening in the laboratory and in clinical studies.
So speaking of the skin, can you give the viewers somewhat of a breakdown of what the skin, the physiology of the skin and the different layers of the skin are?
Well, you know, the skin, although it has layers, it is a very dynamic organ. And there are three layers in the skin. There's the epidermis, which is the outer layer, the dermis, which is the mid layer, and the subcutis or the hypodermis. And all of the layers of the skin are alive, they're active, and they're integrated with each other, and they help the skin to perform its different functions. You know, it's very interesting because the skin not only has to protect us from the environment, we have to be able to interact with the environment and with each other as well. And so all of the functions of the skin with the protection from infection, from ultraviolet light. It has to, delivery of medications have to come through the skin in many instances. And temperature regulation, fluid regulation through sweating, those are all important functions of the skin.
And that's really good information. I wanted to key in just a little bit more on the outer layer, the epidermis. As we get older, we know that that layer gets thinner. Mm-hmm. Can you tell us why that happens?
The epidermis thins out through the adult years. So from the ages of 30 to 80, we will lose about 50% of the thickness of our epidermis. A lot of that has to do with the cells themselves. They become more compact, and we lose water, the skin's ability to retain moisture, and we also lose the ability to retain the healthy fats or lipids. And it's the moisture and the lipids that really make the skin cells plump and thick. So that ability just decreases through the years.
What other things happen to our skin as we age, besides just the thinning?
You know, you may be aware that, you know, the skin seems to tear very easily. So the skin becomes less elastic, and you'll find that sometimes people will say that their skin seems to tear. It doesn't stretch as easily as it used to. And the temperature regulation is a very big deal too. You know, I recall my grandmother always walking around with a sweater on. She was always cold. And the ability to regulate the body temperature comes through the skin, and that goes down through the years as well. Wound repair, that also decreases through the years.
There's an awful lot that's going on with the skin. So can you tell us at what age, or is there an age when somebody should really think about starting to see a dermatologist on a regular basis?
You know, absolutely any age is the right age. Of course, I see patients of all ages. You know, a lot of patients will come in to see me when they have a big birthday. That seems to be the trigger. And they'll start looking at their skin. They might notice new spots. They'll notice maybe new skin growths that they're concerned about. So they'll come in to have a screening, and that's very wise. I will see a lot of teenagers and young adults. In that age group, maybe they're struggling with complexion issues, rashes or warts. And then I can see a lot of children, and sometimes they are born with certain conditions of the skin that need to be evaluated, but also if they have a family history of skin cancer, or if they have a condition that runs in their family, their parents will bring them in to have them evaluated.
Can you tell us a little bit about the different types of skin cancer, what's most common and what's most dangerous?
So the three main types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. And people who are most at risk for these types of skin cancer are persons who have maybe a really light or fair complexion, persons with blue or green eyes, and really fair hair or red hair. But these aren't the only people who are at risk for getting skin cancer. We also know that people who have had heavy sun exposure through the years, or a history of sunburns, or a family history of skin cancer, these are people who are at risk as well. And the skin cancers themselves, basal cell is actually the very most common type of all of the skin cancers. And over 75% of all of the skin cancers are basal cell carcinoma. The melanomas make up far fewer skin cancers. However, 75% of the skin cancer deaths come from melanoma.
Okay, so I have time just for one final question, Dr. Kutch. If someone thinks that they might have skin cancer, what should they do? Is it important for them to get in right away, or do they have some time to seek treatment?
You know, certainly we recommend you get in as soon as possible. I think a 1 to 2 week time frame is very reasonable, and I think that's why it's very good to have an established relationship with your doctor or dermatologist. And that way, if you do have a spot that you think needs to be checked quickly, it's easy for me. We can fit you on our schedule very quickly just to get one spot checked.
Okay, great. Thanks for the great information. We'll be right back with more from Dr. Kutch after the break. Stay tuned.